N-Acetylcysteine and Glutathione in the aging eye. Age-related eye diseases, including glaucoma and retinal degeneration, are driven in part by oxidative stress, an imbalance between harmful free radicals, reactive oxygen species, and the eye's antioxidant defenses. A key antioxidant in ocular tissues is glutathione, GSH, a tripeptide that scavenges free radicals and protects cells. N-acetylcysteine, NAC, is an acetylated form of the amino acid cysteine and serves as a precursor to glutathione. By delivering cysteine into cells, N-Ac can boost intracellular GSH production and indirectly quench oxidative damage. In retinal neurons and trabecular meshwork cells, the sponge-like tissue that regulates intraocular fluid outflow, elevating GSH may protect against damage caused by aging and high intraocular pressure. This article reviews how N-Ac, via bolstering glutathione, may fortify antioxidant defenses in the eye, what clinical evidence exists for visual benefits, and how ocular effects relate to NAC's systemic redox and anti-inflammatory actions. N-Ac as a glutathione precursor in retinal cells. NAC is a lipid-soluble cysteine source that crosses cell membranes and is quickly converted to cysteine, the rate-limiting building block for glutathione. Unlike cysteine alone, NAC can enter cells without specialized transporters. In neural tissues, higher cysteine enables more GSH synthesis. For example, retinal ganglion cells and Miller glia rely on glutamate cysteine transporters to import cysteine and make GSH. By supplementing N-Ac, cells bypass these transport steps, raising GSH levels inside neurons, photoreceptors, and supporting cells. Protection of retinal neurons in RPE. In laboratory studies, N-Ac showed neuroprotective effects on the retina. In 2 mouse models of normal tension glaucoma, coma without high eye pressure, daily N-Ac prevented retinal ganglion cell, RGC loss and vision decline in one model, EAAC1 knockout mice, by increasing retinal GSH and reducing oxidative stress. N-Ac suppresses oxidative damage and even dampens stress-induced autophagy in RGCs. In the other model, glass knockout, N-Ac was less effective, suggesting that NAC's benefit depends on which cells are primarily affected. This work highlights that in at least some glaucomatous optic neuropathies, NAC can raise glutathione in retinal neurons and protect them from degeneration. N-Ac also protects retinal pigment epithelium, RPE, and photoreceptors. In cultured human RPE cells, N-Ac blocked oxidative injury that models age-related macular degeneration. In a clinical trial of patients with retinitis pigmentosa and inherited retinal degeneration, oral NAC for several months improved cone photoreceptor function and slowed visual loss. Specifically, a phase 1 trial found mean visual acuity, sharpness of central vision, improved modestly in subjects taking NAC, and the treatment was tolerable up to about 1,800 milligrams twice daily. These findings suggest that in retinal degenerations driven by oxidative stress, boosting GSH with NAC can benefit retinal cells and vision. N-Ac in the trabecular meshwork under oxidative load. The trabecular meshwork, TM, is the tissue in the eye's drainage angle that controls outflow of aqueous humor and thus influences intraocular pressure, IOP. TM cells are highly exposed to oxidative damage over a lifetime, and reduced antioxidant capacity in the TM is linked to glaucoma progression. Glaucomatous TM often shows DNA damage and cell loss from chronic reactive oxygen species, ROS. In this context, glutathione in TM cells is crucial for neutralizing radicals. Indeed, studies have found lower circulating GSH and antioxidant enzyme activity in glaucoma patients. While direct data on N-Ac in human TM cells are limited, NAC's role as a systemic GSH precursor implies it could support TM health. By raising systemic cysteine and GSH, N-Ac might enhance TM antioxidant defenses. In principle, higher intracellular GSH in TM cells could reduce oxidative damage and prevent TM cell loss. In one preclinical study combining N-Ac with the glaucoma drug brimonidine, an eye drop that lowers IOP, rats with experimentally raised eye pressure showed less oxidative stress in the retina. This suggests N-Ac can act under ocular pressure stress. Moreover, because NAC readily diffuses into many tissues, oral NAC supplementation could indirectly benefit TM cells even if taken systemically. Future studies may clarify how much oral NAC reaches the TM. Clinical evidence for visual outcomes glaucoma. No large human trial has yet tested oral N-Ac in glaucoma patients. However, the preclinical evidence in optic neuropathy models is encouraging. In the normal tension glaucoma mouse models described above, NAC preserved retinal structure and function. A mechanistic review notes NAC normalized redox status in murine RGCs, retinal ganglion cells, and increased GSH. Clinically, one small glaucoma trial reported improved vision with the drug valproate, an HDAC inhibitor, but NAC has not been similarly tested. Overall, while animal models suggest it may protect glaucoma-affected RGCs, no clinical data yet confirm improved visual outcomes in glaucoma patients. Ophthalmologists sometimes recommend antioxidants, but evidence for specific benefit with NAC in glaucoma is still theoretical. Other optic neuropathies and retinal diseases. NAC in inherited or other optic neuropathies. Leber's hereditary optic neuropathy and an inflammatory optic neuritis involve RGC loss with mitochondrial stress or inflammation. N-Ace has not been directly tested in these rare conditions. Anecdotally, NAC's broad redox support could help any optic nerve disease driven by oxidative injury. For example, in optic neuritis, often related to multiple sclerosis, oxidative stress is a known factor. However, we lack trials of NAC for visual recovery in optic neuritis or ischemic optic neuropathy. Retinal degenerations. As noted, a phase 1 trial in retinitis pigmentosa found NAC was safe and modestly beneficial. Over 24 weeks, patients on NAC had significantly better rates of daily visual acuity improvement in treated eyes. By contrast, a cohort of control subjects not taking NAC usually lose vision slowly. These results suggest NAC can improve the function of compromised retinal photoreceptors. Similarly, animal models of retinal degeneration show NAC delays damage and maintains cone responses. Thus, outside glaucoma, there is some clinical evidence that NAC glutathione precursors can help retinal disease, specifically in photoreceptor-driven conditions. Systemic redox balance and inflammaging. Beyond the eye, NAC is well known to bolster systemic glutathione and redox balance. Aging and chronic disease often feature inflammaging, low-grade inflammation fueled by oxidative stress. NAC helps replenish whole-body GSH stores, potentially mitigating such processes. Intravenous NAC is the life-saving antidote for acetaminophen overdose because it restores hepatic glutathione, detoxifying harmful metabolites. Orally, NAC, often combined with glycine, has been shown in trials to safely enhance glutathione status in people with high oxidative burdens. For example, in older adults, supplementation with glycine Plenac 7.2 grams per day was safe and tended to raise total GSH and redox balance in those with initially high oxidative stress. Other studies cited by researchers report NAC glycine restoring glutathione and improving outcomes in HIV and chronic lung disease. In short, systemic benefits of NAC include increased glutathione, reduced markers of oxidative inflammatory stress, and potentially better metabolic health in elders. In the context of the aging eye, such systemic effects may complement local ocular protection. Improving redox balance could reduce circulating inflammatory mediators that otherwise impact the eye. By increasing blood GSH and lowering oxidative byproducts, NAC may dampen the chronic inflammation that partly drives glaucoma and macular degeneration. Thus, ocular antioxidant support from NAC goes hand in hand with broader anti-inflammaging effects. Tolerability, side effects, and interactions. Tolerability. NAC is generally well tolerated at typical oral doses, up to 2 to 3 grams per day. In trials, it rarely causes severe adverse effects. The most common complaints are gastrointestinal (GI) disturbances. Mild nausea, abdominal discomfort, vomiting, and diarrhea occur in some people. In the RP study, 9 of 90 patients, 10%, had drug-related GI effects on NACs, which resolved on their own or when the dose was reduced. These symptoms are usually tolerable, especially if NAC is taken with food. Other occasional side effects include headache, rash, or fever, but serious reactions are rare. Overall, NAC as a supplement has a strong safety record, even in older adults. Drug interactions. Patients should be cautious when combining NAC with certain medications. Nitrates vasodilators. NAC can potentiate vasodilation. In a clinical study, pretreatment with NAC greatly intensified nitroglycerin-induced vasodilation and headaches. This interaction can cause severe headaches and dangerous blood pressure drops. Patients on nitrate or nitroprusside therapy should use NAC only under medical supervision. Anticoagulants and antiplatelets. NAC has been shown to inhibit platelet aggregation. likely by transforming albumin to a more reduced antioxidant form. This antiplatelet effect suggests NAC could increase bleeding risk if combined with blood thinners like warfarin, heparin, aspirin, or clopidogrel. Such combinations warrant caution in monitoring, though in practice, bleeding with oral NAC is uncommon. Activated charcoal. In overdose management, activated charcoal can bind NAC and reduce its absorption. Clinicians therefore separate NAC and charcoal dosing when treating acetaminophen toxicity. Others. Theoretically, any medication whose action involves thiol groups or redox balance could interact with NAC. For example, use with ACE inhibitors, which also affect sulfhydryl pathways, might alter blood pressure. Patients on immunosuppressants or nitrates should inform their physician before starting NAC. Despite these possible interactions, N-NAC generally has few drug contraindications if used judiciously. As always, individuals should consult a healthcare provider before adding NAC, especially if they are on multiple medications. Overall, NAC's side effect profile is mild, and serious adverse reactions, like asthma, exacerbation, or anaphylactoid responses with IV NAC, are rare. Conclusion: N-Acetylcysteine is a well-tolerated antioxidant supplement that serves as a potent glutathione precursor in ocular tissues. In retinal neurons and trabecular meshwork cells, NAC can raise intracellular GSH and help counter age-related oxidative stress. Preclinical studies suggest NAC protects retinal ganglion cells and photoreceptors under stress. In humans, early trials in retinal degenerative diseases, like retinitis pigmentosa, report visual improvement with NAC, while evidence in glaucoma is still limited to animal models. Importantly, NAC's ocular benefits are part of a larger systemic effect. It supports overall redox balance, dampens chronic inflammation, and replenishes glutathione stores throughout the body. This dual action, local eye protection and systemic anti-inflammaging, makes NAC an appealing adjunct in eye health for older adults. Clinicians and patients should, however, note that NAC can cause mild GI upset, nausea, upset stomach, and can enhance the effects of nitrates and antiplatelet agents. In balance, for most individuals, NAC at recommended doses is safe and beneficial. While more research, especially human trials in glaucoma, is needed to confirm its visual benefits, existing data support NAC as a valuable tool for bolstering the eye's antioxidant defense and promoting healthy aging of ocular tissues. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.